top 3 books for SLPs and my favorite and which book I recommend first. Are you looking for some feel-good stories to be re-inspired and reinvigorated as a medical SLP? Or a really solid textbook that doesn't completely fry your brain? Maybe one that considers the patient perspectives? Let's dive into some of my favorites. I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. But My Speech is Fine by Lauren Herman. This book was written by one of my dear friends and colleagues, Lauren Herman. If she wasn't a friend, well, I would still recommend it. This is not a technical manual or textbook by any means, but rather think Chicken Soup for the Soul, SLP version. It's a compilation of feel-good short stories all about the various and unknown settings and conditions that medical SLPs work with. Think newborns, critical justice system, brain surgery, end of life. You might not associate these topics with speech therapy, but that's the beauty of this career. It's surprisingly versatile. From her Amazon description, unveiling one of the world's best-kept secrets, Lauren took it upon herself to share real stories about the misunderstood profession of speech-language pathology. But My Speech is Fine is a collection of Lauren's on-the-job experiences as SLPs with featured stories from various SLPs across the U.S. This book is meant to dispel the occupational myths through eye-opening and heartwarming experiences across the lifespan. With expertise going far beyond the lips, SLPs are here to help you with life's greatest gifts. Allow this book to show you how. Lauren's book gives me such an appreciation for this field. I love our field. I know my friends and colleagues love this field, but there really is a lot of burnout. I think this book is so inspirational and really can help to ignite the passion you have for this field again. It may even give you an idea of settings to further explore. Dysphagia Following Stroke by Dr. Stephanie Daniels and Maggie Lee Huckabee. I know you're probably wanting me to give you the best, most technical textbook full of all the knowledge you need to be the best medical SLP. Well, I don't believe that exists. But this is certainly a close second. This is probably the most technical but easiest to read book all about dysphagia. When I was studying for my board certification exam, this book was my go-to. According to their Amazon description, it is a practical and easy-to-use resource for clinicians treating swallowing disorders in the stroke population. The authors bridge the gap between academic and clinical practice with up-to-date research and clinical case examples throughout. In addition to a thorough overview of dysphagia diagnosis and management, this text focuses heavily on evaluation and management of stroke. Key topics include neural underpinnings of normal and disordered swallowing, swallowing screening, the clinical swallowing examination, including cough reflex testing, the expanding array of instrumental swallowing modalities, and the rehabilitation of swallowing, including strength training, non-invasive brain stimulation, and skill training. While geared toward practicing clinicians, dysphagia following stroke is also useful for students in professional training programs. Are there any specific topics that you would like book recommendations on? Leave a comment below and I'll be sure to address those for you. Also, if you're enjoying this video and want to continue seeing more just like this, don't forget to like, subscribe, comment, and turn on the notification bell. Lastly, of course, I'm going to mention my book to you. So you're having trouble swallowing. Well, for lots of reasons. So you're having trouble swallowing. You feel anxiety during meal times or avoid eating in public. Maybe you've been told that you need a feeding tube, will never eat or drink again, or can only consume thick liquids and chopped up foods. Guess what? You are not alone. Far from it. It's estimated that over 10 million Americans are evaluated for swallowing disorders each year. But if this is so common, why does it feel so lonely, scary, and frustrating? So You're Having Trouble Swallowing dives into the facts and frustrations of dysphagia and dysphagia therapy. I'm a lifelong advocate for my son who lives with a swallowing disorder. After years of clinical practice and fighting for my family, I realized a common thread in the world of swallowing disorders. A large gap exists between research and clinical practice. This gap is really harming patients. Using my frustrations and expertise to fuel the flame, I decided to change the way people receive care for their dysphagia by writing this book for you, the patient or caregiver. This book will teach you the essential information about swallowing, testing, treatment options, and how to advocate for the best care available. Dysphagia is far more than just a disorder. It's a life-altering diagnosis that impacts social gatherings, holidays, family meals, and freedom. It can lead to hospitalizations, high medical costs, and depression. It steals a part of your identity and robs you of one of life's greatest joys, but it doesn't have to. Use this book to guide your questions. Find the right information to charge your advocacy. Most importantly, learn through my expertise and personal journey to get several steps closer to enjoying meals with your family once again. You can check out any of these books on Amazon or go to theresarichard.com/book, where you can get So You're Having Trouble Swallowing for free.